Certainly, as we've come into this year of COVID, or year or 2 years almost now, we have found the importance of innovating what we do every day. So it's very appropriate that the Heart Association, even before this began, had a Center for Health Technology Innovation. This has been going on for several years under the wonderful leadership of Patrick Waite.
There in the American Heart Association's dedication to an interest in the digital health tech, and telehealth space writ large is ongoing, it's dynamic, and it's something that has built on a tremendous amount of research and thinking that we've been doing over many years.
The name of our center is MTech, Mobile Technologies to Achieve Equity in Cardiovascular Health. That name of our center took actually a lot of thought, and in fact was informed by our colleagues in our Center for Health Equity. Originally, if you look at the AHA program, even it has the terminology reducing disparities, but at the direction.
For us, my focus has always been on the brain. But as a longtime investigator at the Framingham Heart Study, I've obviously had to look at sort of the connection between the heart and the brain, but
Hello, everybody. Thank you and welcome to the Health Tech Sessions of the AHA Scientific Sessions 2021. Of course, on the action front, then clinicians usually will contact the patient. And this is actually an important point we should at some point debate or talk about, which is the right balance between tech and human touch, right? At some point, when all of this happens, to close the loop, somebody in a care who has a relationship with the patient, who they trust and respect, will have to reach out and actually communicate, if not communicate the actual intervention to make sure you're not just completely leaving the patient and family members out of the view here, to say
some data plus some model plus some implementation should equal some value. This is the framework under which we're operating here. Mm-hmm. The model, I would say, is the least important part of that equation. It's the data and it's the implementation.
We'll know we're there. A lot of people always ask me, when will we be across the finish line on this? We'll be across the finish line when it becomes just like all the other things. If you think back 20 years ago, we used to talk about online banking or e-trade or online shopping. Those descriptors, those adjectives have actually gone away. We just talk about shopping. And so I hate to say it, we'll know we're there when we stop having these panels talking about digital health, because it'll just be health.
It used to be, for those who are old as I am, AFib was the low back pain of cardiology. We would treat people with, we'd slow their heart rate with DIG, and we'd treat them with warfarin. That was it. We see AI as a tool. Somebody said, is AI going to replace doctors? No, doctors who use AI will replace those who do not.
You could do imaging, because we could do imaging at the time, but the language was still very hard. And the key was, if you can connect those two things and give back to the physician what the computer thought the next step would be, what would be better in terms of the treatment the next time you saw the same patient, then the doctor would make an appropriate choice and guide the algorithm to actually get better. And guiding the algorithm would get better would allow the algorithm, again, to rethink the next phase of moving. And that's how I think reinforcement learning is different from that of the typical machine learning algorithm.
So in terms of the evolution, though, I do believe there's an interesting time here, which is that majority of the AI machine learning models, for the most part, being focused very much on disease diagnostics or disease monitoring, which is physiology or things like that. I think we're also seeing an evolution of that into more disease management, which I think Roger.
Maybe what we should focus on in these opportunistic ECG in the younger patients, especially, and we should start at the younger population, is what is causing their atrial fibrillation. Because once they have persistent AFib, it's much harder to decrease because their left atrium is remodeled, and it's a done deal.
Well, the good news is we can drink coffee.
Yes, I was going to say, yes, coffee does not increase AFib.
That red wine is a no-no.
I think we've seen a lot of changes over the last year and a half with the COVID-19 pandemic. And certainly it has changed some things about the future of digital cardiac rehab. But I think there are also some things about the future of digital cardiac rehab that haven't changed.
That the days of should lists, you should do this and you should sleep better and you should exercise more, is great. I mean, it's of course critical, but it is not what rewires the brain into a new habit. So what's changed? Well, a couple of things. Firstly, the focus, by actually saying, you've got 50,000 thoughts a day. How do you change one of them?
I feel like one of the key elements here is we need to make sure we're building solutions that meet the end users. And so it's really starting with their needs and working backwards. Of course, there's core components of cardiac rehab that we need to make sure are in there, but the way that it's delivered could vary greatly depending on how the solutions are built. And so that's the type of approach we're trying to take, is really starting with our end users and working backwards.
It's so critical that we think about the person and everything that's surrounding them in really making those goals we're giving them actionable. They need to be supported in a holistic and comprehensive way. So just take.
I've been able to take the vision, this amazing vision that was established by Dr. Navarre, by Lynette and Patrick Waite here at the Center for Health Tech, and to nurture that vision and try to bring it to life in a way that meets the goals it's meant to meet, which is primarily improving access to healthcare.
So we dreamt up Doctors with Heart, which is essentially kind of a matchmaking program between cardiologists who are interested in volunteering their time and free or low-income healthcare clinics that needed access to specialists.
So I have to tell you, the program for me has been extremely rewarding. I love talking medicine. I love reaching out, and it's really been fantastic to be able to be hooked up with the system that you guys put together, and Cassie, to be able to, when there are cardiology questions, that I can help and assist.
Today, we have a great and a rare opportunity to discuss mental health and CBD through a multidisciplinary and multi-sector lens. Mental health and well-being is a critical component of overall health and impacts physical health in a variety of ways. For today's panel, we're looking at mental health as an omni-phenomenon, where it can act as a risk factor, a correlate, a moderator, a consequence, or an artifact.
Because what we do know from the research is people who present to physicians with chronic physical conditions, their mental conditions often go unnoticed because it's just assumed that, oh, this is a product of how you're feeling physically. And so that gets ignored.
It's really fair to state that we clinicians in general, I think I can say this as a cardiologist, we're undertrained, or we have very limited training in the assessment of mental health disorders and their contribution towards our patients' well-being. And so for a lot of us, this is really kind of a black box. We don't have the vocabulary, we don't have the skill set to engage with our patients about this very important domain that will impact their cardiovascular risk as well as their chronic disease self-management.
To get us kicked off, I really want to sort of begin with a level setting on health equity, right? Because let's be honest, there are lots of definitions that float around. And the research of REACH has actually revealed that amongst providers and researchers that in fact, there's a misdefinition, an inaccurate definition of the term health equity, as the emphasis being on equity and oftentimes being interexchanged with the word equality. And that's not essentially what we're talking about when we talk about health equity, right? That basically equity is about making sure that people have access to what they need in order to achieve health and wellness, as opposed to simply just being provided with the same tool as everyone else, which may or may not be useful.
It is, again, like being explicit and making sure we're asking everyone those same questions about motivation, health literacy, how their health relates to their occupation and other social determinants of health. So it's very powerful and it resonates.
And it's not just taking tech and then bringing it in and saying, here's the solution. It's really using tech as a platform to meet the needs of the end users. And we see really tremendous opportunity for tailoring.
If you actually study issues that resonate with your end user, that the population care about, like, you can help recruit with individuals when you study topics that are meaningful to them.
Terrific. Thanks, Pat. And good afternoon, everyone. A warm, through the COVID-19 pandemic, we've certainly seen the rise in both the usage and the positive receptivity among patients and providers for remote monitoring solutions.
And many of us were already prepared to a certain extent to deal with that and address that and provide the tools necessary for patients at home. But it really lit the fire to do something about it right away.
How do you get that elderly population up to speed and comfortable with using devices at home, understanding the data, and then connecting in more of a closed loop ecosystem?
It leaves this extraordinary gulf and opportunity to reach people where they live, which is not in front of doctors and in clinical environments for the vast majority of their lives.
I'll just make a final comment. We started our Center for Health Technology and Innovation was created about 5 years ago. And our focus has really been on really helping the tech world get the science right and really helping them to achieve that promise that digital health technology can improve health and health-related outcomes. We all know that it's possible, but we all know it's still a promise that's yet to be fulfilled. And we think this is just, maybe that next step in helping to make this something, so that my mom, who goes on Facebook and buys things on Amazon, can also use an app and a device to help her manage her blood pressure. We're not there yet, but it is possible.